Dr. Lance Carroll, Director of Quad Cities Regenerative Medicine in Moline, Illinois. In this video, I'm going to discuss peripheral neuropathy. So if you're interested in relief from pain, numbness, burning, or cramping without drugs or surgery, you are in the right place. If you'd be interested in 40, 60, or even 100% improvement in your symptoms, this information is for you. For every person watching this, there are 1,000 others with neuropathy that are happy to just take pills for their pain or continue to ignore their numbness. If you are still watching, that means you are being proactive and doing your research to find a better option to heal your pain and numbness. In this video, I'm going to give you the step-by-step method to get lasting relief from pain, numbness, tingling, burning, and cramping, all without taking dangerous pain medication and avoiding surgery. Those suffering from neuropathy may have numb or painful feet or hands, or may feel like they're walking on gravel, marbles, or have pads under your feet. Another symptom is burning or cramping in your feet or legs, or tingling or pain in your hands. These symptoms may also be present in your neck, back, hip, knees, or shoulders. We find a lot of patients come in experiencing joint pain in addition to neuropathy, which we can often help with as well. If you are experiencing joint pain, please also watch our regenerative medicine seminar and frequently asked question or FAQ videos. By the end of this video, you will know the challenging truth of standard treatment, what could be causing your pain, the documented dangers of neuropathy, proven methods for creating lasting relief, and steps you can take to get on the road to feeling great again. According to a 2014 study, the Institute for Healthcare Informatics found that people aged 65 to 79 receive more than 18 prescriptions for new drugs per year. Right here is the cover of Time magazine. They ran a story on healthcare in America, and this was the cover story for their magazine. What the article says from June of 2015 is that U.S. citizens feel that we were over-medicated, and that as a country we were taking far too many medications, all of these being recommended by our doctors. More importantly, there is an epidemic of addiction attacking our society today. And we are seeing concerning increase in diabetes, heart disease, and neuropathy. The healthcare statistics in the U.S. tell us that we are losing ground to those chronic conditions. The numbers are skyrocketing, going up very quickly. As a matter of fact, with conditions like diabetes, we are seeing in younger and younger patients now. It used to be unheard of to see 13 to 14-year-old type 2 diabetes. Now it is epidemic. According to a National Institute of Health study in 2014, the U.S. consumes 75% of all the medications that are made on the planet. But we're only 5% of the world's population. You would think because we have the most doctors per patient, the most hospitals per patient, and we spend the most money for patients, that we would have the healthiest citizens, right? We're not even in the top 10 when ranked in health compared to the rest of the countries in the world. In 2015, the World Health Organization stated that we are actually ranked number 37, right after Costa Rica. That tells me that we are not doing a very good job. We're not taking very good care of ourselves. Our system is actually failing us. One system that is working is our emergency medical system, because if you have a heart attack or a stroke, or you have to go to the hospital after a car accident, and you had to have a life-saving procedure, we do a great job at that. But what we're not doing so good is taking care of our chronic conditions. So you may be asking yourself, what's actually causing this? Drug companies actually spend over $4 billion a year on advertising. The commercials run for a minute and they spend 15 seconds telling you how great the medication is, and the remaining 45 seconds telling you about all the side effects. And at the end of the commercial, they throw a little message that says, now go ask your doctor if this is right for you. These commercials are very persuasive and designed to cause you to spend more money on their drugs. There are only two countries in the world that allow pharmaceutical advertising on television. One is the United States, the other is New Zealand. So, what are the most common culprits in advertising? Neurontin, also known as gabapentin, is the number one medication that doctors prescribed for neuropathy pain, and it's made by Pfizer. Neurontin is actually an anti-seizure medication. It's for seizures. It's a pain management medication, so what it literally does is slow your brain down so you stop feeling the pain signals from your feet. It doesn't heal your nerves. It's not healing neuropathy. It's not keeping it from getting worse. What is it actually doing then? It's masking the pain. Then there's Lyrica, the second most prescribed medication for neuropathy. Lyrica is the same type of medication as Neurontin. Pfizer spent $246 million advertising Lyrica in just 1 year. That was the second biggest advertising budget, second to Viagra. So you might have heard a commercial on diabetic nerve pain because it's a new trademarked marketing phrase created by Lyrica. Treating pain with drugs is just like putting duct tape on your car. Nothing actually gets solved. It's common sense that we need to get to and solve the root of the cause, but unfortunately, common sense is not always common practice. If you saw this light on your dashboard, you would take your car to the mechanic. Then they're going to look under the hood and they're going to diagnose the problem and fix it. Or you could see that light on the dashboard, but rather than taking it to the mechanic, you cover the light up with a piece of tape and keep driving. Now, does this make sense? No. If you're having burning or tingling in your feet or hands, or you're having pain shooting down your leg, or pain in your back, and you go to your primary doctor, what are they going to do for you? They're going to recommend a pain pill. And taking a pain pill for neuropathy is like cutting the wire to the fire alarm instead of finding out what's causing the fire. So let's talk about neuropathy. What is it actually? The definition is damage to or disease affecting the nerves. And this can be associated to your feet, legs, arms, hands, and back. Neuropathy is quickly becoming one of the most common chronic diseases in the U.S. In fact, 8% of the U.S. population, or about 24 million people, suffer from peripheral neuropathy. Peripheral neuropathy can occur at any age, but it's most common among older adults. 30% of diagnoses are linked to diabetes. So, how do you know if you have neuropathy? Well, 7 common warning signs that you have neuropathy are numbness, burning pain, cramping, sharp electrical pain, prickling or tingling, balance problems and falls, and you can't sleep from foot pain. Having neuropathy is like this ordinary household cord. Can you see that insulation is damaged? This is like a nerve with neuropathy. It has damage. If that electrical cord powers your toaster, what's going to happen when you plug it in? It might just spark, it might short circuit. And what does short circuiting mean? It might work some days and it might not on other days. That's how neuropathy could be, especially in the early stages. Most people don't notice they have symptoms every day. What they don't realize is that they start to get it more frequently. As you may know, this is a progressive disease. It only gets worse over time. Or it could cause burning feet. Many people get burning feet. It starts to happen maybe 2 or 3 times a week and then may progress to happening every day. Then it happens all day long and it gets a lot more intense and severe. Diabetes is the number one cause of neuropathy, but it's not the only cause. A lot of things can damage your nerves and cause neuropathy damage. This is a top 10 list. You can be a pre-diabetic and still develop neuropathy. Number 2 on the list is poor circulation. You are not getting enough blood supply to your peripheral nerves. Number 3 is chemotherapy drugs. About 40 to 50% of all chemo patients end up with neuropathy because their medication has damaged their nerves. Neck and back problems like spinal stenosis, disc problems, surgeries, hip replacements, knee replacements, and back surgeries often cause neuropathy. Autoimmune diseases like lupus, infections like staph infections, and alcohol and cigarette smoking also damage nerves. There are also a lot of medications on the market that can actually cause damage to your nerves. This is a nerve chart. Nerves are called axons. They look a lot like the picture of the wire. There are actually 7 different categories of nerves in our peripheral nervous system. They have different functions. On the left-hand side, these are the biggest nerves, and those are the ones that control your muscles, your balance, and your coordination. The symptoms you get when you have a large fiber neuropathy would be muscle cramping, heaviness, tiredness of the legs, and losing balance. You won't feel steady on your feet. The leading cause of injury death over the age of 65 is taking a fall. In fact, 1 out of 3 adults over age 65 fall each year. 20 to 30% suffer moderate to severe injuries. 10% of falls are fatal. When you were 30, you didn't look at the steps when you walked down them. Why was that? There's a nerve that tells your brain where your foot is, so you don't have to look at where you're walking. So when that nerve isn't functioning properly, many people begin having to look at the ground while they're walking and begin shuffling to get around. The nerves on the right-hand side are your small fiber nerves. They give you your sensations, what you're feeling, sharp pain, hot and cold. The symptoms they give are things like numbness, tingling, shooting pains, or hot sensation. So if this nerve is damaged and you have numb feet, what would happen if you stepped on a tiny piece of glass? Well, you won't feel it. It could end up getting infected, and it could down the road lead to amputation. The other major complication of neuropathy is the risk of amputation. In fact, each year in the United States, there are about 86,000 diabetes or neuropathy-related amputations. But it's not just diabetics who have this problem. Anybody with neuropathy runs that risk. So what are your choices? Well, you could choose to do nothing, or you could choose to get more drugs to mask the problem, or you could even get referred to a neurologist. If your primary care doctor isn't very comfortable treating neuropathy, they will refer you to the neurologist. When you go to the neurologist, they will run some nerve tests, they'll confirm that you have neuropathy, then they're likely to prescribe the same medications. This is what I hear from my patients on a daily basis. My doctor told me there was nothing he can do for me. I'm just going to have to live with it. Well, here's what happens when you just live with it. You most likely are going to end up getting an infection at some point. Could lead to gangrene infection. And then what do you think is going to happen? Well, as neuropathy gets worse, sufferers start sitting a lot more. They start becoming very sedentary. They stop doing the activities that they love to do and don't get any exercise to keep their heart healthy. They are staying at home and start getting depressed because they want to be doing things, but they can't. I talk to patients like this every single day. They're very depressed because they can see their quality of life diminishing. But here's the good news. The National Institute of Health says peripheral nerves have the ability to regenerate as long as the underlying nerve cell has not been killed. What does that mean? Not been killed. It means that if you wait too late to where the nerve is dead, it cannot be helped. Note that this is a progressive disease, but here's my question. At the top, you see a healthy nerve. At the bottom, you see a nerve that is damaged beyond help. When do you think is the best time to take action? You want to catch the disease when it's at the second or third stage before it goes to a non-treatable status. So there are 4 keys to feeling better. Number 1, rejuvenate by increasing blood flow. Number 2, stimulate the nerves. Number 3, activate through therapy. And number 4, empower by decreasing inflammation. Some of you may be asking yourself, well, why doesn't my doctor know about this? Well, that is a fair question. According to the Journal of American Medical Association study, it takes over 23 years for information that has been researched to actually get into clinical practice. Let's remember, medical doctors are primarily trained to treat symptoms, and they typically do this with medications. The key is to get the right help from highly focused professionals who deal with your issues on a daily basis. So imagine for a moment sleeping through the night peacefully, walking with confidence and feeling steady again, taking trips and enjoying family outings again. Now, I think it's really important when patients start a program like ours that they have a goal. They have a reason why they want to do it that is beyond just getting relief from symptoms. You want to get back to things you can't do anymore, things that you love to do. So here are your simple next steps. Schedule your consultation. We will perform an evaluation, and then we will recommend a treatment plan. Our consultation process is a 2-visit process in most cases. The reason is the first visit is about gathering all the information that we need, performing your detailed evaluation. Then we have you come back and we go through what we found and discuss if we can help you or not. If we can, then we go through our recommended treatment. Not everybody that I see on the first visit is set up for a second visit. Sometimes we know immediately that you aren't in the right place. Some patients come in and the neuropathy has gone way too far and there's nothing we can do for them. Now, for the people we are able to help, when I give my recommended treatment plan, I will always give my best recommendation. For some whose conditions have progressed to a certain stage, I may recommend regenerative medicine. If you're interested in learning about that, you can watch our regenerative medicine seminar and FAQ videos. We ask that you bring someone close to you to your consultation. We find that your spouse or important person gives us insight into your condition that we wouldn't have learned if we never met them. Also, it's important for your spouse to understand your condition and where it leads if untreated, so you can make informed health decisions together. Now, the cost of the consultation, evaluation, and written recommendations is $249. Because you watch this video to learn all this information and you save me the time of having to do this one-on-one, we are performing these nerve damage screenings at a reduced fee. Having said that, we are not the type of clinic that schedules 20 to 30 consultations a day. We devote an hour or more of our time to each consultation. We schedule 5 to 6 consultations a day at most. So if we do schedule you for a consultation, we need you to show up because that's a big hole in our schedule. Let's go through a scenario where it might not be the right time to come see me for an evaluation. In fact, some of you shouldn't come in. You might like the information, but you aren't that serious about getting healthy. At this stage, feeling better is not a must for you. We only work with people who are committed to living and experiencing a better life. If you think you're going to be the one person that neuropathy isn't going to get worse for, and your health care plan is crossing fingers, our office isn't the place for you. Remember how we talked about how we can't help a killed nerve? If we wait until then, the nerve can no longer be healed. If I can tell you one last thing about neuropathy, that is, neuropathy is a progressive condition, which means it just gets worse over time. So when patients come to see me and they tell me, I only have a little numbness in my toes right now, and I don't have to worry about that, I'll say that is the perfect time to start taking care of it. You don't want to wait until you can't walk or you are in massive pain. The right time to take care of it is the earliest stages. The wrong time to take care of it is when you are really starting to have problems. It would also be a good idea to check out other things on our website, the other services that we offer, also our video testimonials or written testimonials, to learn more about our office and all the different types of things that we are able to help people with. And thank you for watching, and we look forward to seeing you in our office.